Hi everyone, thank you for taking the time to listen to me today. I would like to speak to you about a topic that holds tremendous importance in my family, as well as families, educators, and healthcare providers. That is how pediatric physical therapy can support children with Fragile X syndrome. Fragile X syndrome is a genetic change on the X chromosome, and understanding it, first of all, in terms of X and Y and how it affects males and females differently is a huge part of it. As we all know, as humans, we have 46 chromosomes, 2 of which are our sex chromosomes. We have our X and our Y. Fragile X syndrome is a mutation on a single gene located on that X chromosome. That gene is called the FRM1. In Fragile X, the FRM1 gene, it expands and the segment repeats. When this repeat becomes too large, what happens is that gene becomes silenced, basically meaning that it stops producing an important protein called FMRP. FMRP is crucial for normal brain development, learning, and then also synaptic function. Let's just say it affects males and females quite differently, mainly because the chromosome that it's on, the X, as we all know, men have only one X and females have two. So males only having that one X, if that one X does carry the Fragile X mutation, all their cells may lack the necessary FMRP protein. They don't have that second X to kind of compensate for it. As a result, males typically show symptoms that are more significant. Females, they have 2 X chromosomes. So if one carries the mutation, the other X, if it's normal, kind of makes up for that mutation. Some cells use the normal X, and then others use the mutated X. That is the process that is called X activation. This often results in mild symptoms compared to males. Fragile X now is the most common inherited cause of intellectual disability, I guess we should say, and it's also the leading known genetic cause of autism. Children with Fragile X often experience multiple challenges, such things as low muscle tone, joint hypermobility, balance, and coordination difficulties. They also may have a delay in motor skills, sensory processing, which this, as you know, if you're having these difficulties, this can hinder your independence. This can also make you lack confidence. This also affects your participation in like everyday activities. But, there's good news. Pediatric physical therapy can make a transformative role in addressing these issues and support healthy development along the way. Let's see. Pediatric physical therapy starts with basically understanding how our bodies move, how children's bodies move, how those children process sensories, the noises, the lights, the sounds, the noises, like I said, just our everyday life, how they process it compared to how we process that. For children with Fragile X, like I said, low muscle tone is one of the side effects, and that can make movement feel more difficult and also less controlled by them. Now, physical therapists, they use targeted exercise, playful activities, strength building routines to kind of gradually increase that muscle tone, helping those children gain better stability and endurance. As these muscles continue to grow, you often see improvements in posture, energy levels, and also confidence, which is, we all need that confidence in life. Another important area is joint hypermobility, which means, those joints move beyond like our typical range. This may seem harmless, but with hypermobility, it can make it harder for children to maintain stability, to maintain balance, to maintain proper alignment. Now, pediatric physical therapists teach children how to move in a safer way. Also, they help them to move more efficiently by strengthening their core and surrounding muscles. This helps to improve the alignment. And some of the things they do that with is by introducing activities that center around controlled movement. These interventions help to reduce pain, prevent injury. They also support participation in playing sports and school activities. Many children with Fragile X experience delays in milestones, like motor milestones, such as, just as simple as sitting, walking, jumping, riding a bike. So what physical therapists do is they use structured skill building and child-led play to help close these developmental gaps. Therapists also work on balance through fun, playful optical courses, coordination through simple ball games, gait training, also walk assistance. Something as simple as walking up and down stairs can help those children develop better confidence. Now, these activities, they not only build motor skills, but they enhance their cognitive engagement, social participation, and emotional resilience. A crucial part of pediatric physical therapy for Fragile X syndrome is addressing sensory processing difficulties, which many of these children have. They may be oversensitive to touch, movement, sound, or even visual input. In some cases, they do seek extra sensory stimulation. Now, physical therapists that are trained in this sensory integration approach help children learn to tolerate different sensations, help them learn to regulate their bodies, and help them to stay calm doing everyday tasks. This can help to improve their confidence in everyday settings like being in school, like being on the playground, like being involved in church or community activities. When the physical therapists help with this sensory input, it helps all of these activities more manageable for the children, the teachers, parents. Now, maybe perhaps most importantly, the therapists don't just do a set of exercises. They also like to get the families involved, making this a family-centered partnership. They like to work closely with parents, caregivers, teachers to produce programs that are individual for each one of these students, and also the parents to help them set programs that fit in with these families' everyday routine. These families understand that helping support their child's motor development, encouraging independence, and making sure they understand that celebrating every day, every tiny little milestone, that it's celebrated in huge ways, that these children know that they are working hard to become productive parts of society, if you may. This collaboration with the parents, the caregivers, the teachers ensures that progress continues far beyond just the therapy sessions. In the end, pediatric physical therapy offers these children with Fragile X something, profound. It's the chance to move with more confidence. It's the chance to explore their world more freely, and also to participate more fully in activities that bring them joy and meanings to their lives. With early intervention, tailored support, and a huge compassionate team around these children, they can build skills that they need to thrive physically, socially, emotionally. So that's just a little bit about Fragile X syndrome and how therapeutic sessions with pediatric physical therapists can help to, make lives better. I hope you got a little bit from this. So thank you for taking the time to learn a little bit about how powerful a role in pediatric physical therapy can help these children. So together with knowledge and the support, hopefully we can help every child reach their fullest potential. There are a few places that you can go to learn more about Fragile X syndrome. I do have them listed here. Hopefully you can see this. So I just want to show you. This is, let's see if I can get it to go in, the National Fragile X Foundation's website, their Instagram, and also their Facebook. Again, thank you for taking the time to learn more about Fragile X and the powerful role pediatric physical therapy can play. Have a great day.